on this episode of The Natural Plastic Surgeon. You did something a little more than just swapping out your implants, right?
Mm-hmm.
We did the lollipop breast lift. We swapped out implants. What else did we do?
We also did a tummy tuck. And then, as I was going through the process and talking to my dad, and he's always, really into like making yourself look your best.
Yeah.
He's like, why don't you just do the
So
BB?
your dad told you this?
Yes, my dad did.
You were having a conversation with your dad about
a BBL, yeah.
Oh, wow.
Yeah. So my husband's
Sounds like a cool dad.
Yeah, my dad's, and he looks really good for his age.
Uh-huh.
I'm talking to my dad, and my dad's like, well, why don't you you're already in there, like, why don't you just do it? Which sounds kind of funny, yes. Yeah. But no regrets. Like, I totally think it was worth it.
Let's talk about that. So Mommy Makeover is kind of what you had. A Mommy Makeover is typically a breast lift or breast augmentation and then a tummy tuck, oftentimes combined with liposuction. You went for the Grand Slam.
Yeah.
So you had the breast lift, you had the tummy tuck, you had the liposuction, and then not only did you take that fat, we decided to do a Brazilian butt lift, which is a fat transfer to the buttocks.
Yes.
Yeah.
When I woke up, I was like, I did it all.
You did it all.
I did it all. And
so I call that the Grand Slam Mommy
For
Makeover
sure.
because it's a big home run. Hey everyone, so we are joined with a very special guest, Nicole. And Nicole is a patient of mine. She just recently had surgery. She is a mom of 3, right?
Mm-hmm, 3,
and, Yep. And tell us about the surgery you had and how long ago it was.
Okay, so the surgery was just 3 months. I had a breast lift / reduction because they were I got my breast done when I was 18. And I was a little smaller, and I just thought the Pam Anderson thing was kind of in. So I was like, let me do that. And I just think as I got older, it just got way too big for what I really wanted.
Mm-hmm. When you first, let's back up. So you were 18 years old. You got saline implants.
I did.
And they were, what size? They were approximately 375, but they were inflated up to 450 cc's.
Yeah, they were, when I first met with you, I felt like I was so informed, like just your whole process of what you did for me and like explaining everything to the T. It was just shocking because when I was 18, I didn't know any of that stuff. And I don't really know if he told me or maybe I just rushed it, but I just didn't remember a lot of the stuff you covered. So maybe if you took a little more time.
Yeah.
I wouldn't have gotten so big, I guess.
So you think it wasn't because it was so long ago, you think it was just kind of quick and rushed, the augmentation?
I think it was a mixture of both.
Uh-huh.
It was definitely. But I think I felt like with you, it was like, your body frame's a little, too small for something like that. It wouldn't have been so bad if that makes any sense.
It does. It makes a lot of sense. I get a lot of women all the time that have had implants just too big for their bodies, and I'd love to kind of know, back when you're 18, did it help when you had the augmentation? Were you happy with them, or what happened?
I think I was happy at first. And then since I was so small, I think I received so many stretch marks.
From the implants?
Because I didn't have any, even with my little ones. I got a little bit of stretch marks, but not as much as what the implant did to me because my skin was, I think so small at that time. Yeah. It just stretched it, and it was kind of scary. They were obviously going through the process of what, stretch marks do. They were really red at times. So
wow.
At first I was excited, and then I was kind of a little self-conscious with the way they looked at times. And then, they gradually faded, but the size was just so big.
Mm-hmm. Yeah, that is pretty big. Based on some of your measurements, a 450 would be beyond of what something I would pick for you based off of your measurements. Okay, so that was when you're 18, and then now you're 30 or 31, right? What happened in the interim, and then what made you decide to? Well, let's also back up. You did something a little more than just swapping out your implants, right? We did the lollipop breast lift. Yeah. We swapped out implants. What else did we do?
We also did a tummy tuck. And then, as I was going through the process and talking to my dad, and he's always, really into like making yourself look your best.
Yeah.
He's like, why don't you just do the
So
BB?
your dad told you this?
Yes, my dad did.
You were having a conversation with your dad about
a BBL. Yeah.
oh wow.
Yeah. So my husband's
Sounds
like,
like a cool dad.
yeah, my dad's, and he looks really good for his age.
Uh-huh.
I'm talking to my dad, and my dad's like, well, why don't you you're already in there. Like, why don't you just do it?
Yeah.
And I think I probably emailed maybe like 2-3 weeks prior to the actual surgery to add in the BBL.
Okay.
So it wasn't like on my radar, but then I started watching a little more, and then I talked to my dad, and my dad's like, yeah, you should do it, which sounds kind of funny. Yes. Yeah. But no regrets. Like, I totally think it was worth it.
Well, yeah, let's talk about that. So mommy makeover is kind of what you had. And mommy makeover is typically a breast lift or breast augmentation and then a tummy tuck, oftentimes combined with liposuction. You went for the grand slam.
Yeah.
So you had the breast lift, you had the tummy tuck, you had the liposuction, and then not only did we take that fat, we decided to do a Brazilian butt lift, which is a fat transfer to the buttocks.
Yes.
Yeah.
When I woke up, I was like, I did it all.
You did it all.
I did it all. And
so I call that the grand slam mommy
For
makeover
sure.
because it's a big home run, in terms of we really just address all of the things that happen to a mom. Breastfeeding, they get droopy. We need to revolumize them. Sometimes we need to lift them. I've actually got a photo here, and you're only 3 months. You look incredible. You have a lot of healing left to do, but
Thank you.
I don't know if you've seen this. This is your before and after. Have you taken a look at that?
No, I was kind of curious though.
Yeah.
Oh yeah.
Huge difference.
Yeah. Night and day.
What I love is that your breasts kind of match your body.
Mm-hmm.
They are, and even your nipples are like pointing straight versus pointing down.
Yeah.
Your flanks have.
This looks awesome.
Yeah. I mean, you have this hourglass shape that's just like, it's very feminine, and it's like you've gotten your body back. And I know we still have a little more healing to do, but it makes me really happy to see all of that amazing transformation.
Yeah, it's super exciting. I think for me, just waking up the next day and like seeing my breasts, and that was my favorite part. I mean, the tummy tuck's awesome, but just feeling like the breasts fit me, if that makes sense.
Yeah. Did it feel so? It felt different.
If I was just so excited, I mean, to have these smaller breasts, still nice in size, but that just fit me a little better. I mean, obviously, this picture shows it all. Like, they were just so large.
Right. So we went from a 450 saline implant to a moderate profile plus Siltex 275 cc's. So we went down
quite a bit,
175 cc's per side. And then we lifted at the same time. You actually have really good breast tissue. You didn't really need those gigantic implants anymore. So we actually have some of the skin that we took off over there. We can grab that. You want to grab that?
Yeah.
One of our assistants is actually
sliding it.
Yeah. So this is the big slab of skin that.
That was what I was really like wanting to see at the end. I remember waking up and thinking, okay, like I see all this Instagram stuff. I chose not to do Instagram. I wanted to see the slab.
I wouldn't call it a slab. It's definitely extra skin.
Wow.
But we took part of your tattoo off of there.
Yeah.
It was.
I was a little worried.
Yeah.
It doesn't look too bad. We can hide it.
Right.
I'm not going
well,
anywhere
we could always redo the top part of it to make it
we could.
Yeah. Sometimes we get all the tattoo, but we weren't able to get all the tattoo. But with that, a lot of stretch marks, a lot of fat, a lot of loose skin. And we actually harvested some fat from that to do your fat transfer before we took that off. And that's why people that are considering getting a tummy tuck, if they're thinking about doing a Brazilian butt lift, do it at the same time, right? Because we're already getting that fat. Let's just use it,
Yeah, that's kind of what my dad was saying. He's like, they're already going in there. You might as well just do it. So he definitely sold me on it.
I need to meet your dad because he sounds like a pretty cool guy.
He looks really good. And he's a fan of, lipo and, just kind of taking care of himself as well.
Okay, good.
So
that's good. Well, tell me you can come visit anytime.
I will.
We can take care of them. So let's go back. So right now we're in the operating room that I think you might have had your surgery.
Yeah.
How does it feel to kind of be on the side?
Yeah, it's kind of cool. It's like, man, all that went down in here. And I just feel amazing. So it's really cool, actually.
Yeah. No, that's great. Walk me through. Let's back up a little bit. So you had kind of not so great experience with your first saline implants, and then you decided you have 3 children. Are you planning on having any more children?
I'm not.
Okay.
I'm not. So, kind of how I found you, if that works into it.
Yeah.
I follow Christine Dominique.
Kristen Dominique.
Yeah.
Yeah.
So I follow her. I just love makeup. So I follow her.
She's like a makeup guru, like a makeup like
Yes.
magician, by the way.
Yeah, so I was just looking at her this afternoon. But I follow her, and I was pregnant at the time.
Oh.
So this is maybe a year and a half ago.
Mm-hmm.
And she's going through her experience with you with the tummy tuck.
Yep.
And then she kind of showed it. And then what really intrigued me was the fat transfer.
Mm-hmm.
So that was really what I was thinking when I was, kind of going towards you, and I researched you, and I liked everything you did with that. And then that's kind of what
Fat transfer to the breast?
Yeah, to the breast. Yeah.
So for Kristen Dominique, we actually did a couple surgeries. We did her tummy to get rid of some of the stretch marks, and then we came back and we took out her implants, which were roughly the same size as yours.
Yeah.
Way too big for her body.
Yeah, and that's what I was kind of like intrigued by. I'm like, wow, like she looks so good.
And I encourage you guys, if you haven't already, follow Kristen Dominique. Check out her YouTube video where she undergoes a surgery. It's hilarious. It's a great operation, but she's just does a great job of just narrating it, talking about her big implants that she got out. And we were able to get those out and use fat transfer instead. Which isn't always the case for people. Sometimes I can use fat. And I think in your situation, I said it's probably not going to give you as good of a result. And so that's when we decided to use just a lot smaller of an implant.
And I think what I liked is that you didn't, it's not like you sold it to me. You just made me feel like that was the best option for me.
Right.
And I didn't feel discouraged. I still felt like even though I followed you and I followed her journey in the sense because of the fat transfer, because I was done with having kids and I kind of just wanted to bring my body back. The way you made me feel that day was like, oh, this is the best option just to keep you kind of youthful in a sense.
Yeah, we can always take them out 10 years down the line, and but it's like we only live once, and you're 30 years old, and you might as well look great and a bikini and have that upper pole perkiness and everything. That's what I kind of laid out for people. Like results with fat, sometimes 6 or 7 out of 10. Results with an implant, in your situation, 9 or 10 out of 10, which I think we hit a home run on. So
yeah, I don't feel like they look crazy perky and like, I mean, fake in a sense. They look more natural, and that's really what I was trying to get from it.
Yeah. Well, no, you look fantastic, and it's just getting better. So you decide to do the operation. You have 3 children, and you have a husband. What did you say to them?
At times I was like, ooh, am I being a little selfish? Because I think my little boy is 9 months, right?
Yeah.
9 months.
Right.
Little needy still.
Yeah.
But I had stopped breastfeeding, and I was just really wanting to do something for me. I researched, and I'm a little impulsive.
Okay.
So I was like,
do Amazon boxes show up at your doorstep all the time?
Yes. And my husband's the same way. So I felt like he was very supportive.
Okay.
Just like saying, okay, if you want to do it, sure.
Yeah.
So I think I had my appointment in April, and then we booked it in May. It was super fast.
Yeah.
It was tough. It was tough, but it was something that I wanted to do for myself. 3 kids, I work full time. I just wanted to do something for me.
Yeah.
And this was it. And I felt like my husband was super supportive, and you do need that.
Yeah.
Especially after, a surgery like this. He said it, I did the whole thing. So I needed help. Yeah. It was interesting getting me into bed a couple times, and he helped with that. But
that sounds great.
Yeah. I just think it's an experience for yourself to take care of you for sure. And the outcome, I just feel amazing.
Right. I mean, 3 children. I have 1 child. I have another one on the way. And
congratulations. That's awesome.
I know. Just recent news, by the way. But it's a sacrifice when you have children.
Yes.
And sometimes it's hard to switch gears to start thinking about yourself again. But I think it's important, right? We again, our children are our most important not asset. I don't know. It depends. I mean, you can put them to work, maybe have them come to the office, but no, they're the most important thing that we invest into, and we want them the best for them. But then sometimes there's, it's okay to look out for yourself too, because if you're not the best version of yourself, you're not going to be the best to them either. If you're not happy with your life and your body and everything else, it impacts everything.
Yeah, that's totally how I agree. And I think, man, it feels good to do this for me after, I did and still doing. I'm still doing. I mean, my oldest is 5.
Yeah, of course.
But it's nice.
Nice.
No regrets.
Well, all right. So a lot of people are worried about a lot of things from this kind of surgery. What was your biggest fear from going into this surgery?
So I'm on my feet at work a lot,
Okay.
and I'm a workaholic. Like
What kind of work do you do?
I'm a manager for In-N-Out Burger.
Okay.
Okay.
That's fast paced.
Yes.
You
So
guys always have a line.
yes, and yeah, you're just not, you're just nonstop all the time. So in my
Yeah.
head, I was like, man, like, and I'm the store manager, so
Yeah.
of 94 associates, and I just get to this new store.
90, you have in charge of 94 people.
Yeah, 94
Oh my God.
people. Yeah. So in my head, I was thinking, I need to bounce back. Like, I
Yeah.
can only take so much time off.
Right.
So to me, like the recovery piece,
Hmm.
not because I'm the type of person that doesn't know how to just relax, that I was thinking like, man, I know they say 2 to 4 weeks, but do I have that? Is
Yeah.
what was that piece for me, if that makes sense.
Yeah. And what did you find in terms of your recovery? How much time did you have to take off from work?
I took a total of 3 weeks off.
Okay.
I don't think you need it if you have, a job where you're not on your feet.
Yeah.
Because I probably felt good a week and a half. I just couldn't do much. And then with the BBL, obviously, they really encourage you not to sit so much.
Yeah.
So
That wasn't such a problem, was it?
yeah, no,
Right.
yeah,
If you're on your feet all the time, it's no problem.
yeah. That
Yeah.
piece wasn't a problem at all.
Yeah.
But I definitely felt like when I did too much, it was a little tough. So I took 3 weeks just to feel okay. I want to say by the 4th week at work, working 45 hours, I was okay.
Good.
Yeah, I was okay.
Okay. All right. So day of surgery arrives. You come in. It was kind of early, I think.
Yeah, it was like 9 a.m.
Yep. And who was your anesthesiologist?
I don't remember, but he was funny.
Let's see. I don't have it here. It's probably Dr. Fine. He's one of our favorites.
Yeah, he's
And
funny.
a lot of people were worried about anesthesia. Were you worried about anesthesia at all?
No, I
No?
wasn't. Not too much.
That's good. I mean,
Yeah,
because
I
honestly, the
wasn't-
risks of anesthesia are really, really low.
Yeah, I wasn't really worried about that. I think
Mhm.
it's like will I make it,
Yeah.
In that sense, as scary as that sounds.
Yeah. Of course you're going to make it.
Yeah, for sure. I was just
Okay.
thinking like you think the worst. But I think as a parent you think the worst for the kids.
Yeah.
But no, I wasn't really scared of that.
Yeah.
piece.
I honestly, I wouldn't be doing surgery on people if there was
Yeah.
any remote chance of people
Yeah,
like
and yeah,
having
and
major
that's
problems.
just the fear I had, just being in your own head.
Yeah.
But no, I wasn't. I felt like I was in good hands.
Good.
Yeah, from start to finish.
So day one, did you stay anywhere your
I
first night?
did. I
Okay.
stayed at why can't I think of the name? Serenity.
Serenity.
Yes, I
Okay.
actually stayed 2 days.
2 days.
Yes.
Was that planned or you're like, I just need an extra day?
Day 1 was planned and
Yeah.
taken care of. And then the morning of day 2, since I have little ones,
Yeah.
I just thought, oh man, I can't go home to them touching and then, just things you don't want them to see.
Right.
But it was definitely worth it. I felt like they took really good care of me.
Mhm.
Just kind of with everything I did at once, just putting me into bed, showing me, how to sit and lay and elevate. And
Yeah.
it was just helpful, being able to know what to do in those 2 days so that I could take it home and kind of have a little better understanding of how to take care of myself.
Yeah. They are really professional there. And I always feel good. It's so hard to get availability there because they're so popular. But when my patients do go there, I feel way better.
Yeah, that was good.
So that's good. Any surprises that first few days? Big surprises to you? What was the most shocking thing after surgery? Did you have a lot of pain?
I did that first 1, 2, 3 days.
Mm-hmm.
And then I felt great.
Okay.
And then I guess shocking where it kind of got worse before it got better,
Okay.
if that makes any sense.
What point did it kind of get worse?
Like a week and a half.
Oh, really?
Yeah, where I'm just trying to stand up. And then I think what it is we go back to me doing too much. I think I just did too much at times. And
Okay.
then it was a little bit hard. But when I would totally relax and just, take care of myself, it wasn't bad.
Mm-hmm.
Yeah, it wasn't bad at all.
What was the hardest part about the initial recovery?
Just being okay with somebody taking care of me for a little bit.
Yeah.
Yeah,
Wow.
just being okay with that. Yeah,
And obviously when you had Serenity, it was the nurses, but then when you got home, who took care of you there?
my mom took care of me.
She did?
Yeah.
Okay.
She gave me a pill. I, took it back like I was a child again.
That's nice.
It was really nice. So I
Yeah.
do suggest anybody who's thinking about something like that, like
Yeah.
have somebody available for you for at least a week.
Husbands are good to have, but husbands are sometimes they're not very nurturing and like
Yes.
kind of give you that extra coziness, you know?
Yes. Yeah. My mom definitely made breakfast, lunch, and dinner.
Nice.
It was nice.
That's great. Moms are amazing.
Yeah. I think we left here after the first visit I had with you, and I looked pale.
I know. I think I told you that.
Yeah,
too.
you told me to eat a cheeseburger, and I get home, and my mom's like trying to make everything for me, and I'm like, Mom, I just don't even want to eat. She goes, Did you hear what Dr. Barrett said? He said eat a cheeseburger, so you're eating this pasta.
Nice.
Yeah, it was nice to have that. But yes, I definitely agree. The nurturing part, husband and mother, is different.
Yeah. It's really important, but a lot of people don't realize it. But the amount of surgery that you had, you need about like 30% more calories than you would normally need. And so most people, they eat less than what they normally eat. So what happens is you get a nutrition deficiency and your body's like, I need protein to heal. I need vitamins. I need minerals. And you just don't have it, And so that's where I run into problems with people being pale, they get lightheaded, they can pass out, or they have wound healing problems just because their nutrition is not up to speed right during surgery. So your mom, it's great that your mom was there because that's the last thing you feel like doing. Your tummy's really tight. You had some anesthesia recently. You're maybe some pain medications. That's the last thing you want to do is eat, but you have to.
Yeah, that's definitely how I felt. So it was good having that support because
Yeah.
I probably wouldn't have fed myself. Yeah, probably not.
Yeah, it's hard too.
Yeah.
It's like you don't want to maybe order Postmates, get some
for
pizza
sure.
delivered. I don't know, but
Have something convenient. Yes.
Yeah, the last thing you want to do is get up and make a meal.
Yeah.
So, although I never had the surgery, I've had surgery, but not this surgery. What was the most positive thing about the surgery?
I think how, for sure, just for me, instant was my breast.
Yeah.
Just feeling better. Just putting my work shirt on just didn't feel so tight and uncomfortable.
Yeah.
And then, I just went to Cancun 2 weeks ago and just
how was that?
It was amazing. Just feeling good in a bikini, you know. I'm not saying I was really, big. I just didn't feel comfortable. I felt, especially with my breasts, I felt like they poured out of every single bikini.
Right.
And I just felt good. It was amazing.
That's good.
Yeah, it was really nice, and I got so many compliments, from everybody who went, and it's
really?
it's just nice to hear, from
That's
family
awesome.
and stuff. Like, oh, you look great. So
good.
It was rewarding for sure.
Awesome. What are you doing now in this phase of healing? We talked about it a little bit at the post-op because we just did a post-op appointment.
Scar gel.
Yep.
Scar gel for sure.
Okay.
Just making sure that I'm putting it on religiously.
Yes.
I do like the belly button spear. I can tell when it's starting to kind of close up and when I'm not using it.
Yeah.
It's nice what I find works because I don't think about it. I wear it to work every morning.
Okay.
So I know I'm going to wear it for 9 hours and then I pop it out.
Okay.
And then I could definitely tell that it helps kind of keep it shape. I love the shape that I already have. It really looks natural, but I feel like it kind of keeps it
open.
So I guess that post-op and my breast, the scarring's looking great.
Yeah.
So just, putting more scar gel, I think I need to focus on that area towards the bottom.
Right.
But
that's normal at 3 months, and you're doing a great job. Your scars are actually healing really well. A lot of women worry about the lollipop breast lift, and done right with a good closure and good scar management, it's very minimal, and you get that breast position and shape that you always wanted. And I'm very detailed about closing my incisions. I close the breast in 5. I close the tummy in 4. I also recommend a scar management protocol that's pretty intense. The scar gel that you're mentioning is called Scanuva. It has a lightening agent in it as well, which is why they're fading as fast as they are. And it also has silicone that helps kind of trick the scar cells so they don't form that thick, heavy-duty scar. The other thing is that belly button sphere. It's a round ball of silicone, and I spend about an hour alone on just perfecting your belly button during the operation to give it that shape. But sometimes some people, it likes to close up like a circle. And when that happens, you want to put that sphere in because then it kind of mechanically keeps it open. So that's the rationale behind that.
I think that was the biggest piece. I was scared, and I probably mentioned it a couple times, the scar for the lollipop lift. I was like, oh.
Right, which you can't even see right now.
Yeah,
and you're at 3 months, which is
it's not bad
phenomenal.
at all.
Yeah.
I mean, obviously, you have a little bit of the droop, which is natural. What makes the breast look natural, which hide it. I can't even tell him that was my biggest fear. Because, the tummy tuck, I can hide it. Like, sure, I can still hide it with a bra. But it was just something in my mind, especially when you see that anchor scar and all these different scars that they do. I feel like you can't even see it. It's amazing.
Well, you mentioned something that's actually kind of very dear to me, and that's getting surgeons to get away from that anchor scar. It's completely unnecessary. It's an outdated type of incision where you have an incision around the areola, a line down, and then these horizontal scars that are just absurd. It treats the breast as 2 dimensions when it's actually 3 dimensions. There's a doctor named Elizabeth Hall Finley that kind of came up with this technique, and I learned from her courses how to do it. And now it's all I do. And you're proof of that, of how it just works just way better. So.
Yeah, it definitely looked better too.
Good.
So that was my biggest fear, but I'm happy with it.
Great. What's some advice you can tell a woman or mom out there that's thinking about maybe going through this?
Have a good support system.
Okay.
For sure, a good support system, but also like you're going to have fear in your mind, but the end result, and there's going to be times where it hurts, don't get me wrong, but the end result's so rewarding. And I feel like as a mom, we owe it to ourselves to look good again, to just have that body we once did. Even if it isn't because you're a mom, I just feel like it's life-changing. The tummy tuck is definitely life-changing, just the way, my clothes fit and the way I feel. I feel like the best advice is just go for it.
Yeah.
Because I think there's a lot of, should I? Is this going to happen? Am I scared of anesthesia? Like all those things. But with you, you're in good hands. So I feel like you just have to go for it.
Well, thanks, Nicole. I really appreciate that. And you're such a great patient. Is there anything else you want to share with the listeners out there about your experience or, things that you experienced here or surprises or tips? People that are thinking about undergoing. I know you mentioned the family support. That was a big one.
Okay. Here, I think the staff's just great. Super supportive. When I was thinking about where I was going to go, my only consultation, but I just had this feeling. So I definitely think, like, to the listeners that listen, Dr. Barrett's great. And so is the staff. Everybody's so friendly and helpful. The process was just easy and amazing. And then tips, just really be okay with just relaxing. It is a huge surgery that you go through, and be okay with doing absolutely nothing. A lot of the times it's really hard for us, especially as moms, to do nothing. But just kind of relax.
Good.
And take care of yourself.
That really is important, because that first week or two right after surgery, even if you're mentally stressed, it can impact your healing. Cortisol levels, we know, interfere with wound healing, and cortisone levels go through the roof if you're like checking your emails, if you're on Instagram, if you're not getting help with the kids. Those things can all go through the roof, even though physically demanding, you're not really doing much. So I think that's really hard to turn that switch off, because your job, your life is very busy, and then you were able to turn that switch off, which I think is probably why you're healing already so well. You can calm things down so things can get a chance to heal up. So
yeah, I agree.
That's good.
You have to just do that.
Yeah. And in terms of, thank you for the staff, everybody here, we all care about our patients, and it's like what we get motivated every single day. We're like, how can we help that next person? And I always like to put myself in your shoes. Probably wouldn't get a breast surgery, but I'm like, what would I want if I'm going to undergo this surgery? I want a really safe operation. I want an effective operation to kind of get my goals. I want to have as minimal pain as possible. That's why we inject a lot of pain numbing medicine. I don't want to wait for my appointments. I want to kind of come in and get out and get back to my busy life. And so that's how I try to design everything. And honestly, and transparency, I put it all out there. These are the risks. They're pretty minimal, but these are the rewards, and so I let people make those decisions, and I'm glad you made your decision.
Yeah. Thank you for everything. You're too
welcome.
Great.
All right, Nicole. Thank you. Thank you so much for being on the show.
Of course.
You're amazing. You're beautiful.
Thank you.
And what's next?
I can't wait I'm trying to start dieting and working out now that I can.
Okay.
So I'm excited for my 6-month follow-up.
Let's do it.
Yeah, I'm excited.
All right, Nicole. Thank you.
Thank you.
All right. Give me a hug. Thanks.
Thank you. Hopefully I didn't blow that too bad.